Welcome to Intermountain Medical Center. Each member of our team is committed to providing you with the best possible care in every way. Research shows that patients heal more quickly when they and their families are involved in their care. That's why, during the next few minutes, we'll share some information to help familiarize you with the hospital and encourage you to take a role in your healing process as part of our team of skilled, knowledgeable, and compassionate caregivers.
At Intermountain Healthcare, we value you as a patient, and we value your individual role in the healing process. We believe that good communication between patients and caregivers is important. One of our goals is to provide information regularly and clearly. As we strive to keep you informed about your progress, treatment plans, and medications, feel free to ask questions or raise concerns. You are the best member of the team to let us know if there's something we can do to make your stay a little easier. For example, controlling your pain. We encourage you to ask about what to expect regarding pain relief options. Let us know when your pain first begins and tell us if your medication isn't working as well as you thought it would. Sometimes it can be hard to know how to answer since every person experiences pain differently. Your nurse will explain our pain scale so you can communicate in a way that will ensure we find the most comfortable solution. Here at the hospital, protecting your health is just as important as improving your health. Caregivers know the best way to prevent infections is by washing their hands properly and regularly. Friends and family should do the same with soap and water or by using the hand sanitizer dispensers just outside your door. If you're not sure whether your family members or friends or even your caregivers have washed their hands, don't be afraid to ask. Each room and bathroom has a call button that activates a light directly at the nurse's station. If you need assistance or have any questions, pressing the call button will get your caregiver's attention. Sometimes it may feel like your nurse isn't answering your call as quickly as you'd like. When your nurse is making rounds or assisting other caregivers with an emergency situation, he or she may not be right by the call light. However, your nurse monitors the call lights closely and will answer the call button and respond to your needs as quickly as possible. If you can anticipate your needs a few minutes ahead of time, calling early is another way to help us meet your needs promptly. You may have a whiteboard in your room. It can serve as a great communication tool with your caregivers. First, you'll find the name of your nurse and aide. Next, your nurse will write your goals for the day. Don't be surprised if he or she asks for your help. These are goals that you want to achieve personally and could be as simple as getting your hair washed or walking 15 steps more than yesterday. Finally, the whiteboard is a great place for you or your family to write down questions you might have for the doctor or nurse, including questions you might have about your treatment, your medications, or medical terms you don't understand. If you don't have a whiteboard available, talk with your nurse about other communication options. During your stay, you'll have a team of caregivers to help treat different aspects of your health. You may be visited by a pharmacist, laboratory technician, social worker, or a volunteer, to name just a few, in addition to visits from your nurse and doctor. Caregivers should introduce themselves and their role the first time they enter your room, and take some time to get to know you. For your safety and convenience, every employee and volunteer at Intermountain also wears a name badge to tell you who he or she is. The badges display the person's name, title, and department. Anytime you have questions about someone who visits your room, feel free to ask who they are. Just as we want you to check our badges and ask questions, we will check your patient wristband and ask you questions. Nurses, doctors, and other caregivers should check your wristband each time they give you medication, perform treatments, or draw your blood. These caregivers will also ask you questions such as your name and birth date to double check. It may feel repetitive, but these questions help us make sure every patient gets the correct medication or treatment every time. In spite of these precautions, if you think a caregiver has confused you with someone else, speak up. At Intermountain, we want to provide the best environment to help you heal. We understand that noises created in the hospital environment may be distracting. Rolling instrument carts, opening and closing cabinets, filing patient charts, ringing telephones and pagers, and conversations between caregivers or families make hospitals full of activity. While some interruptions and noise are unavoidable, please let us know if there's something specific that is interrupting your rest. We'll work with you to find the best solution. We may also need to wake you during the night to give you medication or check your blood pressure. We'll do our best to keep this to a minimum and only wake you when it's necessary for your treatment. We are committed to treating you with respect and compassion. This includes respecting your privacy, both your information and your modesty. We will only share or access your information as necessary to provide you treatment, or when you authorize it. We'll do our best to preserve your dignity and ensure that your privacy is maintained with consideration and care. Please let your caregiver know if you have any questions, concerns, or sensitivities. We also want to respect your time. We know it can be stressful wondering how long a procedure will take, or to wait longer than expected. We'll work to provide you with the most accurate information possible, keep you informed, and update you if changes occur. Sometimes delays are unpredictable and unavoidable, but our goal is to reduce inconvenience and keep you well informed. We try to coordinate different aspects of your care to ensure things happen smoothly with as little inconvenience to you as possible. When you have a question about a delay, please let a caregiver know. While we may not know the answer immediately, we'll make every effort to find a solution. For your convenience, we've provided a booklet that contains information about visiting hours and useful phone numbers. You'll also find the location of the cafeteria, gift shop, clergy services, meditation chapel, pharmacy, and other important services. Ask your caregiver if you have questions about the information in the booklet. The more you know about your condition and treatment, the better. Information will help you take an active part in your healing and recovery. Your caregiver may even give you booklets, handouts, or even videos to help you learn. And finally, when you head home, you can visit intermountainhealthcare.org to learn more about diseases, treatments, and medication.
Ultimately, we measure our success by the care we give to each individual patient. We know that healing goes far beyond prescriptions and surgeries. It includes those things that make you and your experience unique. So again, welcome to Intermountain Medical Center. We are privileged to be the team caring for you as we work together to provide healing for life.